really like loud and grainy, and then it comes back to normal.
Yes, static.
Okay, I'm using an older laptop that somebody who just left turned in, so that's good to know that this may have outused its usefulness, but
Yeah. We can hear you for the most part, so. Okay.
I feel like
It
this
is,
I need to talk softer.
it's very occasionally. Will Mark be joining us?
He's having trouble with, I guess Zoom asked for updates. So I had to do the same thing.
Okay. So then we can begin the Board of Health meeting dated Monday, May 8th, 2023 at 5 p.m. Member Chris Mills is not here at the moment, and new member Paul Meehan is joining us.
Chris is joining as we speak.
Oh, wonderful. So I will kick off the review of the meeting format by reading an announcement. In keeping with an act relative to extending certain state of emergency accommodations, this meeting will be conducted remotely over Zoom. Attendance by board members will be remote, and remote attendance shall count toward quorum. The meeting will be broadcast live and recorded on ECAT. To use Zoom, you will need to use the link on the agenda or download the Zoom application at www.zoom.us and create an account or use one of the call-in numbers listed on the agenda. You will need the webinar ID to join by phone only. While conducting meetings remotely, we will endeavor to keep meeting operations as close to our standard procedures as possible. However, use of this platform will necessitate some additional meeting protocols. Number one, while the board members and applicants will be on video and audio, public participants will join the webinar as attendee, meaning they are muted and with no video feed from them. During the public testimony portion of the meeting, members of the public can be recognized by using the raise hand function found under participants from Zoom, or make a request with the Q&A function. If you're joining only by phone, you can press *9 to raise your hand. If an applicant wishes to display materials, please make the request of the chair in the email materials to board staff for sharing on screen. When starting testimony, please state your name and address for the record. There is a markup function in Zoom which will allow you to call out specific areas of presentation material. As in any public meeting, indecent behavior will not be tolerated, and anyone who abuses use of the meeting platform will be terminated from the meeting. Business will be handled at the times indicated on the agenda. Business not concluded in the allotted time will be tabled to the end of the meeting to allow for timely logins and remote attendance. Board members are asked to announce themselves when making a motion and second, so that it will be clear to the audience and the minute takers who made motions. All votes will be by roll call. When all business indicated on the agenda has been completed, the members will vote to adjourn the meeting, signaling the end of the meeting and the termination of the ECAT recording. All participants will be disconnected from the webinar at that time. Applicants will join the webinar as an attendee and promoted to panelist at their agenda item. Applicants will then be able to share their screens and present their materials. As much as possible, presentation materials should be provided beforehand and loaded in Permit Eyes so that materials can be included in the public record. Individual board chair and staff may wish to screen share to their computer. Applicants are encouraged to speak with staff prior to the meeting on how materials will be presented. Okay. And number one on the agenda today is action discussion of reorganization.
So this is, as I was explaining before the meeting started, this is a normal part of doing business after an election cycle where the board would amongst yourselves decide and either nominate someone, nominate second, and then vote for a chair, and nominate and second for a vice chair to act in the absence of the chair. Our previous chair, Lynn LeBlanc, has given up serving, and we now have new member Paul Meehan with us. So I would turn it back over to you, acting vice chair, to direct the rest of this conversation.
Excellent. So we do need to vote in a chair. If anyone has volunteer.
I volunteer Aria. I make a motion for Aria.
Second it.
Yeah.
And I'll second that.
All those in favor? Zayas, yes.
Aye.
Mills, yes.
Meehan, yes.
All right. Well, thank you. Great. I appreciate it. Okay, so then moving on to number 2, meeting format.
Wait 1 second, Ari, does somebody want to nominate someone as a vice chair in the event the
Oh, I'm
chair
sorry.
is unavailable?
I will nominate Chris Mills as vice chair.
I'll second that.
All those in favor, Zayas, yes?
Meehan, yes.
Mills, yes.
All right, perfect. Okay, so then moving on to number 2, meeting format, remotely in person or hybrid, that was pushed to 2025, correct? So it would just be whatever this group decides.
Correct. And I apologize for taking that call while you were reading, but it was actually to confirm one thing that I was unclear on. I wasn't sure if the hybrid option only pertained to us being able to meet in the Corona room, because that's actually set up with the actual cameras. And whether or not, if that were the fact, then that might mean we would have to adjust meeting time and day. The phone call I did just get said, no, there's a few different ways to work around it. So if the board decided to try hybrid, which would give the ability for one or more persons to be remote, but that the meeting itself would be posted and the open to the public would be in a physical location, we are able to still accommodate things like people not being in the immediate area for a meeting and make quorum.
I'd like to make a motion for a hybrid format.
So okay, so even whether we're in person or hybrid, there is a physical space for us at Town Hall.
So if I have to look at the dates that are available. It may mean actually utilizing Frothingham Hall or another location for the physical base. So when the meeting gets posted, if we're hybrid, there is a physical location that the public can come to. As opposed to right now, we're all in separate places. What the hybrid does allow is if one of you or two of you are not able to physically be in the building with us, you're still allowed to participate and make quorum.
Okay, great.
So
Sorry,
I'm
Chris, didn't mean
hearing
to
there's a
interrupt you.
motion. There's a motion for hybrid. If that's the case, I would second that.
All those in favor? Zayas, yes.
Mills, yes.
Meehan, yes.
Very
All right,
good. I
hybrid
will
it is.
look into locations with our normal meeting time and date of the week being the preferred, and I will advise you all if there is any, if we have a problem accommodating that.
Sounds great. And this will be effective next meeting, correct?
Yep.
Okay. Wonderful. Next on the agenda is regulations under review.
So for the benefit of our new member, the Board of Health is charged with enforcing a bunch of regulations that are promulgated by the state and are consistent across the state. In addition to that, the Board of Health has long had the power to enact its own regulations under Mass General Law. Usually it's the usual reference is Chapter 111, Section 31. And basically what it's meant to do is give us the power to do something about situations that are unique to us or that we feel are pertinent or relevant or important and the state laws don't cover. We have a number of these regulations, and periodically we like to undertake a process of self-evaluation and making sure that what we are requiring is consistent with industry, is consistent with the times. So we started down this road and then got delayed a couple of times. And the first regulation we were taking a look at was our private well regulations. And this was partly sparked by the state coming out with a new model regulation, which they typically do in these scenarios. They'll give us a model reg in the hopes that if most towns adopt it, at least there's consistency for industry across the towns. Mark Taylor undertook an extensive review of our existing reg, the model reg, and I think proposed or highlighted just something that we weren't sure that the community was realizing. With the change in membership, it got tabled. The normal process would be for us to present those potential changes to the board. And if the board is in agreement that they want to further the process, then we would schedule a public hearing, which actually requires us advertising in the newspaper a couple of weeks out and a couple additional posting pieces to it. So if the board is agreeable with continuing on that path, Paul, we can provide you with the markup document. And if you want, we can put that on next month's agenda for that first go around, and then be looking at potentially July for a public hearing. Or we could table it and come back to it in September if there's going to be an issue with the public hearing. Some of the other ones that we wanted to take a look at is there've been some changes in the smoking regulations at the state level that we want to either now cover things that we had put our own regulation in, so there's no reason for it to be duplicitous. There's also there's a couple of pieces in our solid waste regulation that I think are inconsistent across our regulations. That would be another regulation that we'd be taking a look at. And that kind of centers around, within the regulation, we don't require a fee to be paid for a recycling dumpster. And when we talk about trash collectors, we're requiring the same collection fee from those new companies that have arisen that do curbside collection of compostable material. So it's 100% recycling, but we're still charging them the fee. And I would make the argument at a later date to the board that to be consistent and to promote these environmentally friendly alternatives, that it might be worth waiving the actual $100 fee for that permit for the person who's going out and collecting them, since they are doing a service to the environment.
No, that makes it. You want to give them incentive. I agree with that.
Yeah, so
The
that's one of
private
the
well,
ones.
if I could real quick, the private well thing, are we looking to exceed what the state currently has?
So we have some things that the state, Mark is probably the better person to speak to on this, because the state doesn't have a lot of regulation. And that's where a lot of these local regulations come from, and follow that path of the model regulation from the state, because we have to do it at the local level, or there is almost nothing. So Mark, do you want to talk a little bit?
Yes, the current regulations we have and the regulations that changes in the regulations will mirror pretty closely to the recommendations from the state. There is no private well state guidelines. They send out a recommendation of what you should do, and we use that as kind of a boilerplate to make our own regulations. They're not more stringent. If anything, some of the testing requirements are less stringent, but still recommended in the well regulation for certain things. I know testing can be very expensive for private wells when it comes to potable water. And a lot of companies are like, well, you know, that one test is $1,500. And I'm like, has it been done in the last 10 years for that one particular thing? Say it's I know, well, PFAS has now been recommended, and that's a thing we're adding to our recommendations, not requiring it, but we're adding it. We do have 2 streets that do have potable wells, being 2.5, part of Chestnut Street, part of Dean Street, and part of Mountain Road, or Mountain Street, depending on what town you're in, do have potable water wells. So it's a very mirrored thing. And when you see the regulation, what I did is anything that would be taken out will be highlighted in red. Anything that's going to be put in would be highlighted in blue. And there's just one little caveat that I highlighted in green just to make the public aware. And that was the caveat, that the well regulations do follow water restriction rules the same as the water department, because you're drinking all from the same aquifer. Drawing up, not drinking, but drawing from the same aquifer.
And we already have something in the bylaw regarding that, right? Regarding the private wells.
So there's a difference between bylaws are enacted on town meeting floor. Board of Health actually has that statutory authority to develop regulations that don't go to town meeting. They follow this pathway of the board setting it out, having a public hearing, and enacting it. So in the absence of, the state does not have private well regulations. They periodically will supply us with a template that says this is probably, if we could do that, this is what we would do. We do have our own well regulations right now that are on the town website in the town code book. And that's what we would be looking to update and incorporate the latest recommendations from the state. And in the absence of either one, well, ours stand until they get repealed, but if they weren't there, there would be nothing governing or protecting.
Yeah, as you mentioned earlier, I'd like if I could get a copy. And then,
So if the board is in agreement, we will put it on as a discussion item next month. And that way, anybody who does have any questions or wants any clarifications will have an opportunity. And if the board agrees that the changes are worth moving ahead with, we'll pick a date to schedule a public hearing.
Thank you.
Next on the agenda for discussion is COVID-19 update.
So cases are still popping up here and there. I think we were down to 4 or 5 in a 2-week period, which is definitely much better. We do anticipate that with the ending of the public health emergency, we will no longer be getting the COVID vaccine for free. So that is something that we will, based on recommendations, start looking at pricing out as we do with our flu clinics, and whether or not we can incorporate that into the same revolving fund that allows us to purchase vaccine in the norm. It's been flu, and then collecting insurance information and billing for anyone who does have insurance and recovering the costs that way. As always, we never turn anybody away. We never go after anybody if their insurance doesn't cover it. It's just a way for us to kind of keep self-funding the purchase of flu vaccine. So we'll keep an eye on that as we move into the summer and the fall. We'll be ordering the flu vaccine shortly, and excited about this being the second year that we're able to do that with our addition of our community paramedicine program and having the firefighters and paramedics available for us.
Excellent. Thank you, Kristen.
Mhm.
Next on the agenda is septic betterment for 61 Elm Street.
Yes, so the resident is in good standing with the town in terms of their bills. They're looking to at least get the place marker 45,000 to pay for the engineering and installation of the septic system. We're going out there doing the perk tests at the end of the month, and probably going to use Bossy Construction to put it in. This is it's 61/63 Elm Street, right up the road here from Town Hall. Small lot, but currently 2 cesspools. But the homeowner owns both units.
Motion to approve the betterment for 61 Elm.
Second,
All those in favor? Zias, yes.
Mills, yes.
me and yes.
Excellent. And then last under action and discussion, we have 163 Washington Street.
So at our last meeting, the owners and engineers for the property located at 163 Washington Street came before the Board of Health, and they were seeking a variance from Title V. Part of Title V says you cannot get a building permit and add on above the design criteria for your septic system. They wanted permission to do that and said, you know, let us do this now, let us add another apartment, and if the system fails, we'll put in a new one, no questions asked. At staff's urging, the board did require that they do a Title V system inspection, as is Title V says the board can do at any time, just to assess that the system was functioning properly as is before we even talk about adding on to it. The result of that Title V inspection was that the system failed. So their request has been withdrawn, and they will be and luckily we don't have a breakout situation. It's been discovered before it's a public health hazard in that it's in the parking lot or flowing down the street or anything like that. And we'll be working with them for a plan to put in a new septic system. And whether or not they decide that they want to incorporate that change in flow and do it under new construction versus doing a repair for the flow that was originally approved is something we'll be working with them on.
Excellent. Okay, other than that, any staff notes or member
Yep.
notes?
I did want to mention that, as I said in the very beginning, there are certain state regulations that we are charged with enforcing. And even those periodically undergo changes, not very swiftly. But one of the ones that has been in the works for quite a while and is actually going into effect, as far as we can tell, on Friday, are revisions to the minimum standards for fitness and human habitation. So that's basically what we refer to as the housing code. And a lot of the significant changes in it deal with, and you may actually see some cases coming before the board that deal with the heating season. The code was very regimented in when the heating system was. And now language has been added that allows, because of some of the global warming factors and some of the things that we've actually seen in practice, does allow the board to waiver that window of when heating is required. There's also been a complete reworking of the section that deals with mold. We didn't used to use the word mold. We used chronic dampness, and mold was a signifier of chronic dampness, and we went after the chronic dampness. The thought process hasn't changed significantly, but there are other avenues and many more pieces to it as well. The three of us have all been through a full day training on the changes and definition changes and language changes, not too much with the enforcement part of it. But they are set to go into effect unless something changes this Friday.
And are these HUD regulation changes or DPH regulation changes?
This is Department of Public Health. So
DPH.
most of our codes are minimum codes. So they're the minimum standards for human habitation. So they deal with everything from trash to exterminating vermin, to weatherproofing, weather tighting, to access to locks, to Mark, Tim, chime in. It's a pretty all-encompassing code. How many square feet you need in a bedroom per person. They're pretty all-encompassing. When screens are required, when screens aren't required.
Building over so many units, the landlord has to have their name placarded with their address and contact information on the wall, like a lot of little persnickety things that are in there, so.
And a lot of very important things that actually do, make sure that we don't have properties that are not being taken care of. We are fortunate, Mark and Tim are both very well trained in housing, and as part of our regional group that we had gotten in with and gotten the grant, we actually have a housing inspector that we share with a few other communities that we can rely on as well, because some of these cases do require pretty diligent follow through and follow up to ensure that we get the violations corrected and cleared off and back to people living in good conditions.
And is this just for rental properties, or is this for single family homes as well?
Yeah,
Across the
it
board.
applies. It's a minimum standard for human habitation. So if you have a messy yard and you own you're putting your trash in your backyard and you own your property, we still could come out if we were called on a complaint. And if that trash is attracting or providing harborage for vermin, we've got rats living in there and skunks and all kinds of things like that, we can order you as the homeowner. It comes into play too when we get into some hoarding cases that may be owner occupied. So it applies to, there's a very clear definition for owner and occupant, and they may be one and the same. Oftentimes when we're called, they're not. There's usually something else going on. And our job is to resolve the problem, get the property back to that minimum standard, and close the case.
Excellent. Any member notes? Any
The only
questions?
thing I would say is, Kristen, thank you very much for helping me get onboarded here. And I'm eager to learn as much as I can about the board and support the cause. Thank you.
We are very welcome, Paul. Like I said, if you want to pick a time and we can come in, I'll show you where some of these regulate, just help you navigate some of where these resources are. I'd be happy to do that. As always, the staff's available for any questions.
Thank you. I'm going to take advantage of that, but right now I've been doing a lot of traveling for work. So, but as soon as that comes to we slow that down, I'll be in to see you. Thank you.
Sounds good.
Excellent. Any questions from attendees?
There are no members no one in attendance, no hands raised.
Excellent.
Motion to adjourn.
Second,
All those in favor, Zias, yes?
Mills, yes.
me and yes.
Bye.
Good.
All right.
Thank
Meeting
you. Have a good
adjourned
night.
at 5:26. Thank you.
all.